right, so chapter 42 of the Fundamentals book covers complementary and alternative therapies. So I'm not going to cover a lot in this chapter. Just be aware that there are many ways to address patients' pain aside from analgesics or with analgesics. So you have things like acupuncture, chiropractic medicine, massage therapy, biofeedback, therapeutic touch, that type of thing. Guided imagery, relaxation techniques, these can all really be effective either with analgesics or instead of analgesics for more mild or moderate pain. They also in this chapter, it lists some natural products and herbal remedies that are often used by patients. I would just know that some of these herbal remedies or natural products can interfere with other medications or cause some complications with medications. So I've talked about this a little bit in my pharmacology video series. So for example, like garlic, ginger, ginseng, these things can actually cause more bleeding. So if a patient's on like anticoagulants and they're also taking these herbal remedies, it can cause like bleeding issues. So it's important that when you're taking care of a patient that you really understand what herbal remedies and natural products they are taking, because they aren't just like inert and just help and don't have any side effects. They can interfere with medications and cause complications. So that's about it that I'm going to talk about in chapter 42. So moving on to chapter 43, which covers bowel elimination. So let's talk about some ways to prevent constipation in patients. So it's important to have them increase their fluid intake to like 2 to 3 liters a day, assuming they're not on fluid restrictions. You also want them to increase their fiber intake to at least 25 to 30 grams per day. So you should also encourage your patient to increase their activity level. So as they are up moving around, this helps to stimulate peristalsis. And then it's really important that patients not use laxatives long term, because this can actually lead to chronic constipation. So when patients are in the hospital, they're laying around, they're often taking opioid analgesics, which we talked about in the last video, which can definitely lead to constipation. So it's really important that you kind of get on top of that and help to prevent the constipation by increasing the fluids, the fiber, maybe giving them some stool softeners proactively in the hospital, and encouraging more mobility, like walking the halls, getting up and moving around. So that is some information about constipation I wanted to share. Let's briefly talk about the FOB test, which is the fetal occult blood test. So this tests for blood in the stool. So you want to collect 3 samples of stool from the patient from 3 different bowel movements. You do not want contamination of the bowel with water or urine. And if you are doing point of care testing on the stool, a blue color will indicate a positive result, meaning that there is blood present in their stool. So those are some key points about the FOB test. Let's talk about how to administer an enema. So often we want to warm the enema solution prior to administering it. You want to position the patient on their left side with their right leg flexed, basically in a Sims position. You want to lubricate the tip or the nozzle of the enema. You want to insert the tip 7.5 to 10 centimeters, which is 3 to 4 inches. You want to open the clamp with the bag level with the patient's hip. So that's how high it should be initially. And then you can raise the bag slowly. You can raise the bag 30 to 45 centimeters, which is 12 to 18 inches above the anus. If the patient is having cramping and pain, then you can slow the flow by lowering the bag back down. So those are some key points as far as administering an enema. So let's talk now about how to change an ostomy pouch. So if you have a patient who has a colostomy or ileostomy, then you will need to periodically change out that whole appliance. So a lot of nurses are scared to do this, and it's really not too big of a deal. So I'm going to explain how to do it here. So first off, you just want to remove the pouch carefully. You can I just use like a washcloth. We have some disposable washcloths, but a regular washcloth is fine, soaked with water, and just kind of gently peel back that appliance and remove it. You want to inspect the patient's stoma. So it should be pink or red and it should be moist. It should not look purple or pale, which is indicative that there's a blood flow issue to that stoma. So you would want to notify your provider right away if you see a pale or purple looking stoma. The skin surrounding the stoma should be intact. You can clean the skin with either just water or some mild soap and water, and you want to dry the area thoroughly. You never want to use moisturizers on the skin because this will, you won't be able to get a good seal with your new barrier. It won't stick well. So just water or soap and water and dry thoroughly. And then you want to cut a hole in the skin barrier that is just slightly bigger than the stoma. So you just want to see like a peak of skin around the stoma. So no more than an 1/8 inch larger than the stoma. Because if you cut it out too big and there's all this skin showing, all that skin is going to get exposed to that stool and to the enzymes in the stool, and it will eat away at the skin. So we don't want a lot of skin showing around the stoma. And then you would just apply the skin barrier and the pouch. If needed, if the patient has some creases or abnormalities in their skin, you can use some barrier paste to kind of fill those in and then apply the pouch. So that is changing an ostomy pouch. And then a couple other things I want to touch on in this chapter. One is the Valsalva maneuver, which can be caused with the patient like bears down or strains. So it's important to advise patients not to bear down while they're having a bowel movement, because this can result in bradycardia, hypotension, and syncope. And then in terms of a patient who is having diarrhea, diarrhea can very easily result in dehydration as well as fluid and electrolyte imbalances, including metabolic acidosis, and it can also cause skin breakdown around the anus. So it's important to understand what the symptoms of dehydration are. So they can include an increased pulse rate, hypotension, poor skin turgor, elevated temperature, and dry mucous membranes. In terms of protecting the patient's skin around their anus, we recommend using a zinc oxide ointment. So this is very similar to like a diaper rash cream. We use something in the hospital called Calazyme. You can use Comoseptine. It's basically like thick zinc oxide cream, and it will protect the skin really well. So that's it for this chapter that I want to cover, and I'll see you in the next video.